the Secretariat for their support in the past year. Thank you.
The Honourable Chan Han-pan will address the Council and report of the Panel on Welfare Services. The Honourable Chan Han-pan. President, as Chairman of the Panel of Welfare Services, I would like to report to the Council the main areas of work of the panel during the 2022 session. Members were most concerned about measures rendered by the administration to assist and support residential care homes to combat COVID-19. We asked the administration to enhance the epidemic prevention capability of RCHS to adopt indoor care air quality measures to achieve comprehensive vaccination coverage for all elderly RCH residents, to regularize the provision of Chinese medicine practitioner service, and to set up an independent task force to review infection control measures in RCHS. Since the suspected child abuse incidents at the children's residential home, members have been closely following the administration's review of residential child care and related services, and were pleased to note that the administration had taken aboard measures suggested by members in adopting a number of important measures, which include strengthening surface monitoring, enhanced manpower supply, and increased provision of RCC centers. Members in general supported the administration's legislative proposals on mandatory reporting requirement for suspected child abuse cases, but expressed concern about the reasonable time frame for reporting and the penalty for failure to report child abuse cases. Members also proposed to strengthen or to streamline the reporting mechanism. To ensure our elderly are well taken care of, members have followed up on the implementation of recommendations in Elderly Services Program Plan. Members suggested the administration should increase the supply of daycare centers for the elderly, improve community and integrated home care services, and promote the use of gerontology. To enable a more focused discussion on residential care services, the panel appointed a subcommittee on increasing the provision of RC places for the elderly and to consider and follow up on the administrator's initiatives. Members generally supported legislative amendments to enhance the quality of RCHs for the elderly and for people with disabilities, respectively, but were concerned as to whether RCHs could meet the statutory requirement on space and manpower, and urged the administration to relax the height restriction for RCHs to optimize the use of land resources. The relevant bill is being scrutinized by Bills Committee of the panel. We also discussed other issues during the session, such as review on enhancement of the lump sum grant subvention system, progress of welfare facilities project funded by Lotteries Fund, and various social welfare-related issues. In particular, members were most concerned about support for carers and urged the administration to raise the amount of subsidy for carers, improve respite services, enhance community care and support services, and promote to carers the greater use of technology to enhance their care capacity and to reduce their burden. I'm grateful to the Secretariat for their assistance and cooperation. Thank you.
Mr. Michael Look will address the Council on the